Hi everyone, and very good evening to all of you. The exam is over, and I hope that you are feeling quite, sublimed with the effort that you have put in the last few months. I'll say, not to be bogged down by the questions or the difficulty level of the questions. We'll have a good discussion upon how the exact paper was in around 10 o'clock today. But this session is only about discussing your answers and whether you marked it correct or wrong. More importantly, it's about discussing the questions which actually came in the INI-CET today. And um, the analysis of paper is a different video altogether. In this video, I'll focusing only on the pathology questions. As always, I say that the subject is and has been very important. Not less than 25 questions came from pathology, and I'm thankful to every of my student who was able and helped me to recall those 25 number of questions. So that's huge in number when you talk about the subject priority when it's set up in the INI-CET questions. So I welcome you all who have joined me. Very good evening to Shafi, Patel, Ajay, and Patel. Um, First of all, I like all of you to tell me how the paper was, because my analysis of pathology was, it was not an easy one. First of all, let me be very frank to you. I will not say it's an easy one, but I will say it's a very tricky one. So questions were based on the previous year question and topics, yes, but the options were not so easy. And especially, when we talk about a paper with having multiple options, like answer is one or one and two, one, two and three, or one, two, three and four, that even becomes more important, because that's ask you a lot of things, and you have to know about every option. Therefore, I would just request all of you to take part actively in my discussion mode, not to be bogged down by the question standard or what you have made it right or wrong. It's the right time to, interact with me, talk to me as to, sir, why was this answer not correct or this option was not wrong. And I would honestly tell you, I have not given the paper, but I would request all of you to please take part in the discussion of this paper and let me know if I can correct any of the questions or any of the options with your help altogether. So yes, I'm surely telling you, if you ask me, sir, how do you rate the pathology paper? I would say the pathology paper was not easy at all. It was very tricky, taking into account the options, the multiple choices question, the image based question. They were not easy at all. But when it's not easy, it's not easy for anyone, and that is how the paper standard is set up. When I talk about the aims has never been easy, and aims will never be easy, but that doesn't matter a lot. I know anyhow the paper was started, in a difficult level for most of us. So let's not talk about that difficulty level at the starting of this video. I believe that we should first talk about your paper analysis, whether you're able to finish the entire paper or not. And let's start with uh, the questions one by one, and that is my question number one here. So guys, I'm starting with the INI-CET Recall of November 2022, the paper which actually was done today, that is 13th of November. And in this paper, I'm discussing the pathology question of the part 1 today, that is which started at 9 a.m. and was finished at around 12 p.m. So the paper was quite a bit on the lengthier side and was very tricky. I'm starting with my first question, and this is the first question. Identify the instrument which was actually shown here. So guys, this is actually a bone marrow aspiration needle, and very importantly, when you look at this needle, there is no side screw. There's no side screw here. Now this is one question which we actually and always discuss in our class also. When they don't see there is no side needle, so the answer to this question should not be a Sala, because Sala has a side screw, so answer should be A. It must be Klima. The answer must be Klima. So why it is Klima? Because there is no side screw. Where there is no side screw, it cannot be Jamshidi. Jamshidi is a long needle and has a handle at the back. So this Sala would have a side screw actually. And hence I would say this is not the answer. Islam is not frequently used at all nowadays. And Jamshidi needle is something that's a long needle, and it has a handle at the back, something like this. And there is a trocar, or you can say there is a stellate inside it, which is held by this type of structure in the upper surface. That is actually Jamshidi nail. How the answer to this question, clearly it's a Jamshidi nail, because it does not fit into this image. So one more thing, so for those who actually want to become a part of a Telegram group, do take part in the active discussion. You can join my Telegram group here, and do take part in the active discussion of my Telegram group. You just scan this and to enter my Telegram group, and you may please add upon what your exact image was. I will be more than happy to incorporate all of your corrections into this, if at all there is any. Okay. Identify the image in the given below. I think this is one question which I've been seen for multiple times in the AIM exam. I don't know what has happened to them. Well, this is a Gaucher cell, Gaucher cell, and what is inside them? It is called as tissue paper crumpled appearance. Okay, it's called as tissue paper crumpled appearance, and this is seen in a Gaucher disease. And what is inside this? Actually, it's a full up of glucocerebroside. Because of glucocerebrosidase deficiency, it is called as glucocerebroside. It's also called as C blue histiocyte. It's called as C blue histiocyte. So the answer to this question is Gaucher disease. This is actually a macrophage of the bone marrow, and because of deficiency of the glucocerebrosidase deficiency, the glucocerebrosidase they deposit in the macrophage, and that gives a tissue paper crumpled appearance, and that is actually a feature of a Gaucher cell. I move to the next question. A 24-year-old patient has a history of neck swelling on the right side of the thyroid, which moves with declutination and predisposes to the risk of development of which of the following cancer. So this question is talking about this histology. And now in this histology, you can see there is a movement, and you know all of these cells actually have a papillary structure. All this papillary structure here are quite visible, and therefore the answer is papillary cell carcinoma. So in this image, my most of my students have recalled that it was not showing you, sir, orphan anemia nuclei, but thankfully, sir, it was very clearly showing us a papillary pattern. So whenever you have a thyroid gland with this type of normal follicle cells, and this has changed to the papillary shape like this assay. Okay, and in the papillary shape you may sometimes see, even though it was not seen in the image that was given in your exam. So this is what it was shown like this, right? And that is what is called as orphan anemia nuclei. However, the question did not have the orphan anemia nuclei. The question was actually a image based question. Now, you know, two questions have been suggested to me here. One of the question given to me was, sir, one of the question was, I don't know whether it's true or please let me know, that one of the question was, sir, there was a history of thyroglossal cyst. Okay, because thyroglossal cyst often leads to the carcinoma. And the second question that was asked in some of the students that they suggested me, sir, it was showing you a muscle invasion. And that too, some of the students told, sir, it was actually showing you a sternocleidoid muscle invasion there. So I think that was the one thing, that is what was the history also present there. However, the history, what was suggestive of, the answer was clearly papillary cell carcinoma because it's papillary shape. Okay, so two things were given more into the history: thyroglossal cyst and also the muscle invasion was also suggested to me. Sir, why it is not a Hurthal cell tumor? First of all, it's a Hurthal cell tumor is not an actual term. It's a term is follicular carcinoma. The Hurthal cell finding is not a tumor, actually it is seen in the Hashimoto thyroiditis. Okay, Hashimoto thyroiditis. Answer, why it is not riddles? Because this shows fibrosis of the gland, and this will always show you increase in immunoglobulin G4 levels. Immunoglobulin G4 levels. Okay, so anter-strap muscles was showing you also invasion. There was an invasion into the anterior strap muscle. This was a probable history given to you. So I think that is one history we can add here, but the answer remains same. It was actually the papillary carcinoma was the answer. So I think you might have made this question correct. Let me just remind you of all the high yielding facts I've discussed with you in the previous few days about the thyroid carcinoma. Please ensure you go through all of those details. Remember, the mutation in papillary carcinoma is BRAF, and know that the red gene is involved in the biliary carcinoma, because that too was asked today in the second part of the exam of INI-CET. So thyroglossal cyst was also one of the option. I think we can just add it there. Okay, anyhow. So the given peripheral smear is associated with this leukemia. Now, this is actually a case of, what do you see this one? This actually becomes a case of smudge cell. Okay, these are actually smudge cells, and these are the mature lymphocytes. So with a smudge cell and a mature lymphocyte, I think the answer was basically very clear, and the answer becomes a case of chronic lymphocytic leukemia (CLL). Okay, chronic lymphocytic leukemia (CLL). So sir, why is the not answer AML? देखो बेटा, अगर if it be AML will show you always a immature cell with a large cell. Along with that, there would be some OR rod seen there, which was not seen there. Why not CML? Because CML will show you the shift towards the left with myeloid series cells, which can basophils, eosinophils, and therefore it cannot be case of CML also. So why not ALL? For the same history, because AL will show you blasts, and the blast will have high NC ratio without any nucleus. But this all dark chromatin, these are dark chromatin. These all are mature lymphocytes, and hence the answer cannot be acute leukemia. It has to be chronic leukemia actually. Okay, so the one more question given to you was for the question of CML. Please don't confuse this question to one more question. I'll show you that other question was also there. That is one other question given to that. So this was one other question. A white blood cell count of 4,50,000 was given, sir, with eosinophilia and basophilia diagnosis was asked, and this answer surely becomes a case of CML, chronic myeloid leukemia. So if you have such a high TLC with eosinophilia and basophilia with left shift, this could become a case of chronic myeloid leukemia. Okay, chronic myeloid leukemia. So history said basophilia and eosinophilia was given. So I think this is one other question which we are confusing this with another question. So this one more question. This answer surely becomes a chronic myeloid leukemia. And let me tell you, the chronic myeloid leukemia actually shows a garden party appearance. The next investigation, if asked, will always be a lab score. And if it is asked the confirmatory test, you have to go for FISH analysis demonstrating the PH chromosome of translocation 9 with 22. But that becomes a case of a CML. So this was, I think, the one other question in which the answer was given. And sorry, there was the eosinophilia and basophilia was clearly given with that. Okay, peripheral smear analysis was given with this one only. So I will just request you to please let me know what the exact peripheral smear was in my Telegram group. Please, again, I request you all to please join my Telegram group and please take active part in my discussion so that I can get the exact question. Please scan through this and get to the Telegram group and please let me know what exact question was for the today's exam. Okay. So this was question number 6. Okay, some of you are just telling that this was not the question. So now maybe this was a wrongly recalled one. So I'll just look into this. Okay. Shift to right was mentioned. Sir, shift to right was mentioned. But with a history of eosinophilia and basophilia, it looks like to be a case of a CML. Chalo. Which molecule helps in movement of leukocyte across endothelium? What have you marked for this, guys? What question did you mark? What answer did you mark for this question? And I think most of you might have marked this correctly. It's straight away a case of, yes, it should be a case of PCAM1. So PCAM1, also called as CD31, it helps in what is called as transmigration. Okay, transmigration, and it also helps in a molecule called as diapedesis. Okay, E-selectin should not be the answer because selectins often help in the purpose of rolling. CD11A and CD18 are often helpful in addition. They actually are belong to the category of LFA and MAC1, and surely addition cannot be the answer. So addition word was there in the question itself. So movement across this, I think that answer should be PCAM, and I don't think the answer could be anyhow CD31 or addition should be the actual the question there. So I think this is quite clear cut answer. It is PCAM. Okay, CD31 is the other name for PCAM, and full form of PCAM, if you know, it is platelet endothelial cell adhesion molecule, is the full form of PCAM molecules. Well, I'm very fond of saying one thing in my classes, and students have also calling me now Bahubali, and I always say Bahubali is one thing, and I give you so many examples of Bahubali, helping it throughout the classes, and most of you also get bogged down कि Bahubali तो बोलेंगे ही sir. So this is one example of the Bahubali, and yes, the Bahubali of the liver is Kupffer cells. The dust cells are in the bronchioles and the lungs, actually in the alveoli, and the lungs may it is seen in the alveoli. Okay, Clara cells are often in the bronchus and the bronchioles. Bronchus and the bronchiole especially have the Clara cells, and parietal cells actually are in the stomach. Okay, parallel cells actually are in the stomach. So I think that most of you will remember me from my Bahubali. I keep on saying this so many times in my classes. That's why it's always envy ki sir Bahubali ek do bar aur bol do. So yes, that is the actual answer here, and you can just, it was match the following, and this is the right answer to match the following of that question. So if you have any correction in that, please message me up here, and I will surely be incorporating that also in my recall sessions. Okay. So let's move ahead. Okay, this is, a one of a question which I'll say was actually very confusing. And let me just solve it for you. The question was asking you a 10-year-old boy with hemoglobin of 7.6. Matlab, this is low. Correctly, it's low. There's anemia, no doubt about it. MCV is also low. It is 56. Correct. MCH is also low because MCH normally is 30. Now, the question was giving me that a ferritin is 150, but the normal ferritin is 130 to 160 was given in the question. But what we can say is the ferritin value here is normal. Do you all agree? The leukocyte count given was 7600, which is quite normal here, with a lymphocyte of 65 and a neutrophil of 30%. So what have you marked for this question? I really want you all to speak up and tell me what actually was going up there. So देखो, if you say the ferritin is better normal, please samjho. Let me explain this question again. When the ferritin is normal, it cannot be iron deficiency anemia. It cannot be a case of anemia of chronic disease. Okay, anemia of chronic disease. Okay, ferritin was given as 140. Acha, now comes a big problem. So ferritin normal was given as 140, then it increases, and then becomes the case of anemia of chronic disease. However, let me tell you, anemia of chronic disease will not show you such a low hemoglobin, because I've told you many a times in my classes that anemia of chronic disease will always show you normocytic normochromic RBC more common than microcytic hypochromic RBC. So I will not believe that ACD could be a possible answer. Now, sickles and anemia I also don't believe, because it does not showing you any sickling or any such clinical features of sickling. So according to me, the answer should go as thalassemia, because thalassemia will show you such a low hemoglobin, such a low MCV, such a low MCH, and ferritin may be normal or may sometimes increase, but it doesn't matter a lot, because ferritin value may increase because of more absorption from the GIT, because the person is actually having such a anemia. But telling you one thing, why are you thinking about ACD when the TLC given to you is normal? What is trying to what is telling you a TLC? Please understand one thing. This I can tell you. If you get a normocytic normochromic RBC more common than microhypo, then you can think about anemia of chronic disease. So this should not be an ACD, even with a mild amount of increase in ferritin. But first of all, think about such a low hemoglobin with normal TLC. Why are they giving you normal TLC? Because they want to rule out anemia of chronic disease. Anemia of chronic disease का conditions क्या क्या होता है? It is seen in chronic inflammation, malignancies and autoimmune disease. ऐसा कोई history नहीं है यहाँ पर. तो why to think about anemia of chronic disease with such a low hemoglobin and MCV, MCS? Think about the thalassemia. So obviously देखो RBC was not there, so don't think about calculating Menzer. देखो Menzer index कहाँ calculate करोगे? You have to calculate Menzer index only when you have given MCV and the RBC, right? But MCV and RBC में MC was given, RBC count तो दिया ही नहीं है ना, so don't think about Menzer index. Also remember, Menzer index will differentiate a thal trait वर्सेस आयरन डेफिशिएंसी एनीमिया. यहाँ पर थैल ट्रेट तो हो ही नहीं सकता ना. क्यों नहीं हो सकता? बिकॉज hemoglobin is such a low. With such a low hemoglobin, it cannot be thaltrate. So we're not thinking about thaltrate at all. So now comes a question of a patient having a hemoglobin of 7.6. Therefore, my answer here goes in favor of thalassemia. So ferritin slightly raised, I'm definitely agreeing to you. With slightly raised ferritin without a TIBC, without a iron, you should not mark just ACD on the basis of slightly high ferritin. If at all the ferritin was supposedly, as you're saying me, if ferritin was sir around 130 to 140, right? So 130 to 140 was given, and here the ferritin is 150. It's very slightly high. That slightly high cannot be a case of anemia of chronic disease. So lymphocytosis is normal in a case of child. Lymphocytosis is normal in a case of child. 60% lymphocyte is normal in a child. Please understand this. Okay. CBC, normal CBC में the lymphocytosis is normal in a child. So do not confuse that thing with what you are seeing here. According to me, the answer goes in favor of thalassemia. I don't think the answer should be anemia of chronic disease. But if you have more history here, you are more than free to just let me know what else am I missing in the question. But according to this history, I don't think the answer could be anemia of chronic disease. ठीक है, 149 तक अगर नॉर्मल है तो 150 हाई थोड़ी है, इट्स नॉर्मल. Ferritin in AC will go beyond 300, 600 जाएगा, will not be so normal. Okay. And secondly, uh, lymphocyte of 60% is normal in a case of child. Okay, children have lymphocytosis, so there's not at all a anemia of chronic disease again. So I think that is one thing which you should. Now, if you're saying hemoglobin was 10.6, that again becomes anemia only, right? It again is anemia. So I don't think that that should again go in favor of anemia of chronic disease. Please again remember, ACD may it is n by n more common than microcytic hypochromic RBCs. But surely, I think this is a question which should create a small amount of discussion. But my answer for this should go in favor of thalassemia, because I don't really think that if you even think that it is a case of ACD, you should have a very high ferritin, low TIBC, low iron, and low saturation. With that, you should have a chronic history. Chronic history कहाँ दिया है इसमें? You should not think about ACD here. Okay. मैक्सिमम एम्पलीट्यूड इन टेक एग्जाम, तो मैंने क्या बोला आपको जब भी पढ़ाया, तो लास्ट टाइम नीट में टेक का इमेज आया था, इस बार आपको डेफिनेटली टेक पूछेंगे, पक्का पूछेंगे. तो व्हाट इज थ्रोम्बो इलास्टोग्राफी? दिस बेसिकली बिलोंग्स टू थ्रोम्बो elastography. Now, in thromboelastography, I think all of you who have done my classes, I always mark this point as primary plug. याद है? Primary plug. And then I mark this part as secondary plug. And then I talk about this as clot lysis. ये जो part है last वाला, I always talk about this as clot lysis. So, when you talk about the primary plug, this is a primary plug. A primary plug is formed by what thing? Is formed by platelets. The simple answer to this is a platelets. Okay, so the simple answer to this question is platelets. Okay, so primary plug बनता है, then they form a secondary plug. ये primary plug है, secondary plug है, and lysis. I discussed this in all my classes. I also discussed this in my test and discussion this year. TND में जहां जहां मैंने TND लिया, every area I have discussed with you the thromboelastography, telling you that this question will surely come this year in the upcoming NEET INI-CET exam. Okay. So, senile atrophy is due to. Now, this is a hot favorite, and it's a old recall question. It's a very multiple time repeat question. Senile atrophy is seen in the brain. Okay, first of all, you should understand senile atrophy is in the brain and occurs due to atherosclerotic changes. Atherosclerotic changes, and often it is due to the ischemia. It is often due to the decrease in the blood supply, and the main answer is blood supply decreasing causing ischemia. That actually is the ischemia. Okay, the following markers will be positive in case of Hodgkin's lymphoma. So Hodgkin lymphoma में क्या marker आएगा? Hodgkin lymphoma is classical example of 15 and 30. So answer will be both A and B. Answer will be both A and B. Okay. 19 will be surely negative because of B cell marker, and 3 will also be negative because of T cell marker. So answer will be both A and B. 15 and 30 both are positive in a case of Hodgkin's lymphoma. Okay, so I think this should one more thing that you should be taking care of, and you should knowing what the option of Hodgkin lymphoma. Do not forget everything on Hodgkin lymphoma. उसका सब कुछ पूछा जाता है. I know these are hot favorite, and you cannot miss these. They show rhesus cells, the type of Hodgkin lymphoma, classical, non-classical, and the percentage of Epstein virus positivity with the owl apparent. These are very important stuffs in NEET or the INI-CET. Okay. No, 19 is not positive. Okay, 19 is not positive in Hodgkin lymphoma. 19 is negative in Hodgkin lymphoma. तभी तो उसका नाम Hodgkin रखा ना. It's a not non-Hodgkin lymphoma. 19 is negative. B cell, T cell, NK cell marker is negative. Okay, so 1530 is only positive. Answer is both A and B here. Now, this is one question I like really, this is one rare question asked. It's an absent graft versus host reaction in a patient with bare lymphocyte disease is due to deficiency of. क्या कहना चाह रहा है? This question is pointing towards a patient having bare lymphocyte disease. अब ये होता क्या है? Bare lymphocyte disease is a very rare form of primary immunodeficiency disorder where a patient has deficiency of MHC class 2. Okay, there's deficiency of MHC class 2. So because of the deficiency of MHC class 2, okay, there is deficiency of CD4 T cells, and so there is deficiency of B cells also. So because यहाँ पर CD4 और CD8 both are absent, it comes in category of combined B and T cell defect. Now, अगर patient में B और T cell defect होगा, तो that patient may not be able to develop a graft versus host reaction. The only treatment for such patients is a bone marrow transplantation. Bone marrow transplantation. Remember, this case is a case of Bayer lymphocyte syndrome. Let me tell you one more thing. Bayer lymphocyte syndrome is of two types, type 1 and type 2. Type 2, समझो बात को, type 2 is more common than type 1. It's called as major Bayer lymphocyte syndrome. यहाँ पर is absent of MHC class 2, and टाइप 1 इज रेयर टाइप, इट्स एब्सेंट ऑफ MHC1. तो सर इसको हम कैसे सॉल्व कर सकते थे? बेसिकली देखो, इट्स कैन नॉट बी अ कॉम्प्लीमेंट तो हो नहीं, कैन नॉट बी कॉम्प्लीमेंट बिकॉज कॉम्प्लीमेंट इज नथिंग टू डू विद अ लिम्फोसाइट. ओके, नाउ टी सेल, if the T cell is absent, they cannot be a lymphocyte at all. So it's called as bare lymphocyte. कह रहा है lymphocyte is there but it's bare. Okay, and that is actually an absence of MHC class 2 more than class 1. Okay, more than class 1. So CD4 cell is in the option, not T cells. Okay, so there was also a CD4 T cell was also there, but if you have an option of MHC, the basic problem of Bayer lymphocyte syndrome is absence of MHC class 2. Okay, next question. So I hope you all will remember again from my classes when I talk about the TH1, TH2, TH17. This is the diagram I always explain to you in the classes. TH1, TH2 and TH17. So TH1 is T helper cells and TH2 cell is what produces IL-4. So this cannot be the answer. So with the following cytokine is not seen in TH1, the answer straight away becomes IL-4. But remember, interferon gamma, IL-12 and TGF-beta or IL-2, was some students have recalled this to be a IL-2 and some students have recalled this to be a TGF-beta. These two are the molecules which are involved in the TH1. Okay, TH1. So a better answer to this question is actually interleukin 4 because IL-4 is not at all. Okay, some students now say it is also TNF alpha. So TNF alpha also is not there in the TH1. So if TNF alpha is the option, that also is not there in the TH1 cells. Okay. If the question was TNF alpha, that should also not be there. Let me again remind you that TH1 cells क्या होता है? TH1 will release IL-2, IL-12 और interferon gamma. ठीक है, याद रखना. TH2 will release IL-4, IL-4, IL-5 and IL-13. And TH17 release IL-17, 22 and 23. Question can again be repeated next year that this activates, answer is CD4 cells, CD8 cell and macrophages. This activates B cells and eosinophils, and this activates neutrophils and monocytes. This question can again be asked in the next question. If the question is about the TNF alpha, that should also not be in the right answer. Okay. Next question. Match the following. अब देखो, what is talking about, I think what you should understand is, if the question is asking you solitary thyroid nodule, thyroid nodule can be taken out by FNAC, that too ultrasound guided. So at least you should mark this one as USG guided FNAC. I think this is one thing that should be clear. If it is single cervical lymph node, अगर एक lymph node है, so small lymph node, excise this, so do excision biopsy. Okay, excision biopsy. So if you can mark these two, I think the answer would be quite simply solved here. Now the question comes under margarine ulcer and sarcoma. First of all, what is the problem margarine ulcer? A person who has burn can have margarine ulcers, right? And that can progress to squamous cell carcinoma. अब सोचो यार, so think about. Squamous cell carcinoma can show you invasion. So when you take a biopsy, you must look at the depth also. Got the point? Suppose there is a area here and there's a large ulcer here. So if you cut this lesion, you want to take it out. You can take it out like this, as you can cut it out. But the problem is, how will you get to know that how deep the lesion is? To know how deep the lesion is, you have to take a wedge biopsy. समझ आ रहा है? You have to take out a wedge biopsy. So for margarine ulcer, you basically take out what is called as a wedge biopsy. Why, sir? Because it can progress to squamous cell carcinoma, and therefore you should take out a wedge biopsy there. For sarcoma on the thigh, there you can take out a incision biopsy, or what is called as a core biopsy. Incision or a core biopsy. ठीक है? Just to diagnose it, to whether the sarcoma is there or not there. So I believe that this is the right answer to this question and could be solved by just simply thinking about what is the logical reason why you do these investigations. Okay? Mass in the stomach is CD117 positive, but cytokeratin and S100 is negative. So what is the answer? So the moment you say there is mass in stomach, it could be GIST or adenocarcinoma, maybe lymphoma also. Telling you CD117 is positive, the answer straight away becomes a case of GIST. So when it's adenocarcinoma, so CK is negative, so CK is positive here and hence cannot be the answer. Hodgkin lymphoma होगा तो इसमें LDH is positive, इसमें CD15, CD30 will be positive, and a squamous cell carcinoma will again have cytokeratin positive. And I hope you all remember the importance of cytokeratin is actually in a case of, yes, every epithelial tumor or carcinoma will have cytokeratin positive. Do not forget the other IHC. मैं बता रहा हूँ, I tell you in the classes, अपना नाम भूल जाना, ये मैं बोलता हूँ क्लास में. You can forget your own name, but do not forget IHC. इतना important IHC, और आज तो IHC ने भर दिया. The 5 IHC asked in this year's exam. How can you miss IHC? So IHC, remember, for carcinoma it is cytokeratin, for sarcoma it is vimentin, for HMB45 it's melanoma. For melanoma shows HMB45. Remember, LCH has S100 positive. Do not forget synaptophysin, chromogranin, and neuron specific enolase, which is also positive in the neuroendocrine tumors that also came in today's exam of INI-CET. Not to forget, the exam also asked you about the P40, P53 and P63. All of those are so important IHC coming up nowadays. Okay. The following is true. Some students have recalled this to a separate question altogether. So just surely KIT is for just, there's no doubt about it. So KRAS for amplification. Yes, KRAS can be seen for lung carcinoma also. So if there's a multiple option, so this also looks true. ERBB for breast. Actually, देखो, if the question would have been ERBB, that's actually called as EGFR2. So EGFR2 is nothing but a HER2 new receptor. That also looks true. But astrocytoma, some students say it is PDGFR beta and some students say it's PDGFR alpha. So I would go for PDGFR beta is not the right answer for astrocytoma. It often shows PDGFR alpha. So I would say if this was the question, then I think the answer should have been A, B and C. But suppose it's a single best answer, the answer is A. However, if it is a multiple choice question, then the answer should be A, B and C, all of them. So let me know what exactly was the question here. Was it multiple choice or was it a single choice here? Okay. So IHC of P40 positive cell with histopathology slide was given. So when you have such a important keratin pulse, मैंने क्लास में इतनी बार बोला बेटा दो इमेज को पहचान लेना, एक स्क्वामस सेल कार्सिनोमा and one is adenocarcinoma. And what is this? It's a case of keratin pulse, and so the answer is squamous cell carcinoma, and hence the answer is squamous cell carcinoma. Okay, what is this? It's a case of keratin pearl, and hence the answer is squamous cell carcinoma. Now, देखो how much confusion it is. Some of you are saying it's a single choice and some of you are saying multiple choice. अब देखो when you are getting confused, given an exam, now you're getting confused. How confusing is for this for me, especially for getting you this question. But again, I repeat, guys, please take part in the discussion on my Telegram group. Please scan this code, join my Telegram group, follow me on Instagram, and let me know if you have any other doubt in these questions or how to prepare, what to do in the coming days. Please let us know how we can help you in the coming days also. A chronic smoker with 24 packs with breathlessness and chest pain, lung tumor is present on staining positive for chromogranin. देखो आ गया chromogranin. So this is actually a case of small cell carcinoma. Why? Because it is showing you a case of chromogranin. I remember chromogranin, synaptophysin, neuron specific enolase with CD56 are the main IHC which are positive in the case of any neuroendocrine tumor. Okay, neuroendocrine tumor. So therefore the answer becomes a case of, yes, it should become a case of small cell carcinoma. Okay, small cell carcinoma. Okay, S100 was some other question, not in this one. S100 was there in the question of the gist, not here. Okay, the following are the proto-oncogenes of a virus, and I think you all might have understood this. It's talking about the human papilloma virus. So in my class I always tell you बड़ा easy है याद करना, E6 और E7 याद करो. 6 inhibits P and 7 inhibits R. So 6 inhibits P53 and 7 inhibits RB gene. That simple case of E6 and E7 belongs to the human papilloma virus. And also remember how I also tell you that what happens because the single condition is that because the P53, this often, if there's a complete inhibition, complete inhibition, this is actually causing a high risk HPV. High risk HPV example 16, 18, 31, 33. And partial inhibition would be a low risk human papillomavirus 6 and 11. Okay, 6 and 11. So if the question was L1, L2, in the option was L1 and L2 was given. Okay, L1, L2 was also given. Okay, ठीक है. Not E1, E2. L1 and L2 was other the option. While the answer was very clear. Oncogenes or proto-oncogenes. In fact, the proto-oncogenes will convert to the oncogenes and again will cause a cancer. So this is basically a case of the E6, E7, which is actually a case of human papilloma virus, which causes the proliferation of cervical epithelium in the cervix. If the question was about the proto-oncogenes, okay? If the question is proto-oncogenes or oncogene, this was the right answer, okay? So, are you suggesting that E6 and E7 was not the option? Okay, one option was L1 and L2. E1, E2, E5 was one other option. Okay, E1, E2, and E5 was one other option. And one option was L1, L2. One option was E1, E2. Okay, E1, E2 was other option. So I think now we are getting all the four options. It was E6, E7 as the better answer there to be more precise. Okay, E1, E2, E5 was also the other option. Okay, this question. True about certain. I think this is one question which might have confused most of you. देखो, no doubt the answer must be B. कोई doubt ही नहीं है इसमें. But please let me know, was this a multiple choice question or not? Please let me know, guys, was this a multiple choice question or not? Was it a multiple choice? So in that case, the answer would be surely it's of 7 types. It's a type of histone D acetylase, but it does not increase insulin sensitivity. It actually increases insulin resistance. Okay, so it decreases insulin sensitivity and therefore will decrease glucose metabolism. In fact, it will increase actually the glucose. Okay, it will actually increase the insulin resistance. Okay, it increases insulin resistance. So A cannot be there. So if this is a single choice question, in that case the answer would be I think B. But if it's a multiple choice question, it would be B, C and D would be the best answer possible. Okay, remember, and if it is the most common, so I also talk about this, that is Sirt6. If you remember, Sirt, S-I-R-T, Sirt6 is the most important and the most common gene which causes the same effect. I talk about this class, it's actually a type of NAD dependent acetylase, NAD dependent protein, and that is what is called as a histone D acetylase. Okay, disacetylase. Okay, so next question, the following is true regarding hemophilia A. True regarding hemophilia A. So I think this was also a multiple choice question. So because a multiple choice question, surely the answer would be A. It surely is X-linked recessive, and because it is X-linked recessive, it has to be more common in the males compared to females. But mucosal bleeding is not the basic effect because it's a type of secondary plug defect. Secondary plug defect, I think this we have discussed something multiple times in the question. Secondary plug defect actually is presenting with actually what is called as a joint may, there is hemarthrosis on joint, and there is a muscle hematoma. Hemarthrosis and muscle hematoma. So it should be A, B, and C in this case. It should be A, B, and C in this case. So in the previous question, now some of you are suggesting that the option was it increases insulin resistance. Okay, are you asking me? Okay, देखो, if it will increase the insulin, if it decreases the insulin resistance, तो क्या होगा? The glucose will enter it more. And I'm telling you, the basic idea of delaying aging is decrease entry of glucose. Simple logic, right? And therefore it increases insulin resistance so that the entry of glucose is less. A history was given of repeated joint swelling in the question. Okay, so the question was a repeated history of repeated joint swelling. No, Sirtuin increases insulin resistance. Okay, question 21. Oh, sorry, 21 is also there. I'll just come back to that. Sorry. And thank you. Lot of question in pathology. I always tell you that you read pathology very well. In the upcoming NEET also, I expect this type of paper where pathology is one of the most important subject in the entire 19 subject because it holds many other subjects together. So have a very good hold of the subject pathology will really help you score very good rank. Okay, so sir, I have missed 21 number question. Let's come back to that. About hereditary, that is what is correct. Now first of all, you have to tell me whether it's a single choice or multiple choice question, because in this case high MCH cannot be pathognomonic of any disease. I don't think that's the right way to approach it. Gallstones will develop by 4 to 5 years of age. Yes, it may develop. That's plus minus. I'll say it's plus minus. Okay. Splenectomy does not protect about again gallstone. Please understand. So if you remove spleen, there's no extravascular hemolysis, right? So as समझो इसको, if spleen is removed, there is no extravascular hemolysis, so no gallstones. So this is not true. The only possible answer here is A then. The only possible here answer is A then. There's no multiple choice question, then the only possible answer here is A. If it is multiple choice question, then I would go with A and C, but D is surely not true, and high MC is never pathognomonic for HS. Pathognomonic is something hallmark. So high MCHC can be seen, but high MCH is definitely not seen. Remember, however, HS, remember, has increase in MCHC, but not increase in MCH. Definitely not. Okay. ये हो गया. Question 23 भी हो गया. Okay, this one. So a patient underwent a surgery 1 year back, now presents with fatigueness. Investigation suggests this patient has macrocytic anemia. The following part rejected. It's not an image question. Please remember there's no image here. I just put this image to make you explain this question. Now, if you look at this one, basically the intrinsic factor comes from the stomach. It will actually combine with the B12. Okay, it will combine with B12 and then it is going into the duodenum. Okay, so in the duodenum there is action of the pancreatic enzymes, because of which these actually split up and then go to jejunum. In jejunum there is no absorption. It finally will reach the ileum, and there, with the help of intrinsic factor receptor, it is taken into the intestine. Will taken into the intestine. So what do you think is the answer here? The question here asking was, the following part rejected cannot, this was the question, cannot cause this condition. So which part, if you reject it, it cannot cause a simple condition? What have you marked in this question? The question was cannot cause this condition. देखो, intrinsic factor comes from it comes from stomach. Okay, then there is action of pancreatic enzymes in the duodenum, then absorption occurs from ileum. So what is the action of jejunum? What is the action of jejunum in the entire B12 absorption? Nothing. So the answer clearly is jejunum. Okay, because jejunum may the pancreatic enzymes come, and that will actually change, or will break the intrinsic factor along with the hepatocorrin in that area. Now, this is one more question. It's not exactly a pathological question, but I think I can, I can explain you this, what is happening here. So consider the following scenario. A patient has HDV and HBV. Both of them have high load of the DNA and RNA. Now, in the given our scenario, these are the conditions given here. And now the question is asking you, which of the following makes the diagnosis towards co-infection rather than the super-infection? Super-infection. बोलो, which of them is pointing towards co-infection and super? समझो co और super क्या है, खुद ही नाम बता रहा है. Co मतलब together, super मतलब once there is HBV then comes HDV. समझो बात को. The name itself telling you, एक है co-infection and one is super infection. So co-infection will mean that a patient of HDV and HBV will come together, and super infection will mean HDV infecting on a case of HBV. The question is asking you that the following makes a diagnosis towards co-infection rather than super infection. तो अगर पेशेंट में मान लो co-infection है, in that case it should be HBV में IgM type, और super infection है तो it would be case of IgG type. The question asking you co-infection. So what is point towards co-infection? It is IgM HBC antibody. So the answer should be the positive IgM for actually the HBV. So it's pointing towards IgM variety of HBC core antibody of hepatitis B is pointing towards a co-infection rather than super infection. So there's a lot of values was given here. I think, sir, the option was negative IgG HBV indicating co-infection. Yes, that's also one. So if it was uh, one option was HBV IgM is there in the option. HBV IgM is there in the option, so that is the right answer. However, option was negative IgG, so that is also right answer. If the question was negative IgG HBC antibody, that also is right in right answer. If it is HBV IgG, देखो अगर ये HBV IgG होगा, इस पॉइंट टुवर्ड्स सुपर इन्फेक्शन, नॉट अ को इन्फेक्शन. सुपर क्या होता है? सुपर मतलब HBV is there, on that comes a case of HBV infection. Okay, so if both of them are there, I think both of them should be the right answer there. Negative IgG and positive IgM HBC antibody. So if you have to choose one of them, I think this is a better answer compared to this one. It's a better answer compared to this one. Okay. I think we have discussed this question already. And this is also we have discussed. Molluscum contagiosum patient was shown. This actually is a case of microbiology, but I can just discuss with you. It's a case of Henderson-Peterson body. It's a Henderson-Peterson body. Okay, Henderson-Peterson body. They asked, sir, which indicates co-infection. So isn't that better to mark negative IgG rather than positive IgM? So they asked indicating co-infection. No, I don't think that's a better way to approach that case. A better answer is positive IgM rather than a positive IgG there. Okay. Okay, about this question as already discussed, it's a case of chromogranin, so it's a small cell cancer. This I already discussed, it's a case of thalassemia. Class switching occurs in IgM and IgD heavy chain remains constant. Which property is this? So I want more information what exactly the question was, because what exactly is class switching? Okay, somatic hypermaturation was there. That's very good. Then the answer becomes very clear there. If the somatic hypermaturation was there, because what is affinity maturation? So affinity maturation actually belongs to a case where there is more specific antibody produced against antigen. But please remember, I have not got the fourth option. Please let me know what the fourth option was. Then I think we can also discuss the fourth option there also. Okay, so please let me know the fourth option. I think that would be a better way to approach this question. But the fourth option, what was the fourth option there? Please let me know. If we have a better option than that, so maybe we can look into that also. There was allelic what? So allelic should be, one thing should be asked, what exactly the allelic term was asking you there. Okay. So guys, I think that is all about the question here. But I again ask you to please join my Telegram group by scanning this code and let me know if I missed any point or you want to add something. The analysis of paper, I'll be doing this today at 10 p.m. in the night. So please join me there also. Okay. Thank you for your patient listening, and I wish you that you all do the best. I believe that the paper was on a bit tougher level. I don't think it's easy. It was very confusing with very tricky options given all together. But the topics was not new. It is all the same topics being asked in a new framework, and the new questions were given. But a lot of questions was also repeated. But pathology always and will always be important. And do ensure for the NEET exam you read this subject in a better way. I'm always there to help you. Let me know how I can improve your subject in whatever way is possible. Do join my Telegram group and my Instagram. You can follow me up and let me know if I can help you in some other way also. Thank you guys. Wishing you all the best. Take care and God bless you all.